Welcome to the Hashimoto's Doctor Podcast. You're now part of a growing community of people determined to take their health back through education and self-empowerment. But because of the healthcare system today, we don't have access to the types of healthcare that we want. So we have to do things differently. We've got to do things smarter, and we do that by becoming our own advocates. This podcast will give you the perspective and thoughts of one of the world's leading Hashimoto's doctors. So let's get started. Hey guys, Dr. Shook here. I hope you're doing well today. In today's podcast, what I want to talk to you guys about are some different factors that affect your thyroid's ability to actually produce thyroid hormone. A lot of the people that follow me, they have hypothyroidism. I would say that is the biggest problem with the thyroid in the world is decreased thyroid hormone output, which we call hypothyroidism. Now, the number one cause of that, it's estimated that about 90% of people that have hypothyroidism actually have an autoimmune condition where the immune system's attacking the thyroid. And that's called Hashimoto's. Now, most people are undiagnosed. They don't know that they have this autoimmune problem. But in addition to the autoimmune condition, there are a lot of other things that can cause and contribute to decreased thyroid hormone production. The first thing that you have to look at are stressors. And when we talk about stress, people think the first thing that comes to mind is emotional stress, right? They're placed under stress and they're having some form of emotional stress, whether it be work stress or money or relationship stress. That's what they think of. However, there are actually three different types of stress. There's the emotional stress. There's also physical pain. Physical pain, interestingly enough, when you're in pain, it stimulates a stress response. Your body will produce stress hormones. Because what happens is emotional stress and physical pain, they both stimulate part of your nervous system that's called the fight or flight. We call it the sympathetic nervous system, but it controls the fight or flight mechanism. And that's what's driven whenever you have emotional stresses or when you have physical pain. They both drive the same kind of response. Now, the third type of stress is chemical stress. When we talk about chemical stress, it's really anything that can produce chemical inflammation. And a good example of that is the autoimmune process itself, like Hashimoto's or any autoimmune condition. It drives the autoimmune process. Just a byproduct of autoimmunity is that your body produces these immune system proteins called cytokines. These cytokines, they are inflammatory. Well, we tend to refer to them as inflammatory. They have inflammatory and anti-inflammatory effects, but primarily they're inflammatory in nature, and they are also something that can produce and drive a stress response, as are things like food sensitivities, chronic infections. These things all have an inflammatory component to them. So it's really the stress of inflammation, the chemical stress. Now, sometimes there could be medications that would drive a stress response, primarily though because they produce hormonal changes or drive that sympathetic system, that sympathetic nervous system. So those are all the stressors, right? Those are the different types of stressors. And when we can really group probably everything we're going to talk about, we're going to break some of these things out more specifically, but we could group the rest of the things that I'm going to talk about into, one of these three subcategories of stress. So for example, infections, trauma, radiation, medications, as I mentioned, all these things can drive the stress response. So those are things that would drive, more along the lines of the chemical inflammation. And if you have a chronic infection, and many people do, there are lots of latent infections. They're hidden, they're stealth. They may be, asymptomatic or there's no symptoms, and they're a GI infection. We find that all the time when we do advanced diagnostic testing. There's a lot of different things. There can be viral infections. There can be yeast infections, and they don't have to be, in women. We often think of when a woman says she has a yeast infection, it's most commonly thought of as being like a vaginal yeast infection. However, we probably find more commonly GI yeast infections, gut infections of the bowel. And so if someone's had extensive antibiotic use throughout their life, they're much more susceptible. So those are a lot of the factors. These are all things, guys, that, by the way, can inhibit or decrease the production of thyroid hormone. Literally decrease your T4 production, your thyroid hormone production. Other things would be environmental chemicals, which, listen, guys, chemicals or toxins, we can think of those as a chemical stressor, right? So I mentioned the 3 different types of stress: chemical, physical, emotional. The environmental toxins, it's interesting because the environmental toxins don't all work on, the mechanism of their action is not inflammation. Some of them can drive and will drive an inflammatory response, but some of them mimic hormones. Some of them disrupt hormone signaling. They can either increase or decrease the sensitivity of your body to certain hormones. So they have these pretty wacky effects that can be very, very confusing, especially when you're not expecting it, when you're not thinking about it. And I can tell you that for the most part, environmental chemicals, unless it's some kind of acute, obvious exposure, like you're at work and you got exposed to something and you were exposed, and then you go to the doctor and say, hey, I was exposed to something. And unless the doctor's thinking about it, it doesn't even come into their thought process that your hormonal system may be getting disrupted by environmental chemicals. And we know that there are literally hundreds of chemicals, if not thousands of chemicals, in every single one of our bodies. There have been several different studies. There was one done on cord blood, looking at cord blood and the number of chemicals in there. And of the chemicals that were tested, there were somewhere along the lines of 200 plus chemicals found in cord blood. So our babies are being exposed to this stuff before they're even born. And then we get in the shower and take a shower and we absorb several hundred chemicals just through the water, from the water right into our skin, our drinking water, the air that we breathe. So no one's thinking about this. No research has been done assessing this. So it's really important that you realize toxic burden, reducing your toxic burden, detoxifying your body are absolutely critical aspects of getting healthy. I mean, they're keys to improving your health as much as possible. We live in an increasingly toxic world, guys. Those are the facts. If you don't believe it, just do a little bit of research online. Go to PubMed, where I do tons of research, and you'll find paper after paper after paper, research paper, showing that we are being bombarded by toxic chemicals day in and day out. Bombarded. Air, water, clothing, in our cars, everywhere, in our food, everywhere. So toxins work on multiple mechanisms, right? They can increase or decrease our hormone activity. They can drive an inflammatory process. They can disrupt our nervous system, and there's all kinds of effects that these chemicals have. And when we talk about toxins, we're talking about things like pesticides, heavy metals like mercury. Mercury, cadmium, and lead in particular have been shown to have significant impacts on the thyroid and decreased thyroid hormone production. So when you're looking at things like that, you're looking at fluoride. Fluoride's actually an antagonist to iodine, so it will displace iodine, and iodine is required for thyroid hormone production. Now, I'm not an advocate of you going out and grabbing high dose iodine or taking iodine in high doses without at least having a 24-hour urinary collection to assess your need for iodine. I don't recommend, I don't personally like or recommend high dose iodine at all. I'm not, some people with Hashimoto's, there's some research studies that show that there are some people with Hashimoto's that have actually done much better in specifically and intentionally restricting iodine. I don't find that that's needed. What I find that works very well for us is to utilize very small, low doses of iodine to make sure that there's enough iodine, and then make sure that the antioxidant status is very high, like selenium and lots of other antioxidants that help to minimize any inflammatory responses, and just make sure that the normal chemistry can occur, right? I think that's really a key factor. So those are a lot of the things that play. And then, like I said, autoimmune disease, Hashimoto's drives decreased thyroid hormone output. And Hashimoto's, the reason that it decreases and it drives decreased thyroid hormone output is because what ends up happening is the immune system attacks the raw ingredients required for your body to make the thyroid hormone. So your immune system's attacking your thyroid peroxidase enzyme and your thyroglobulin protein, both of which are required for the production of T4. So if your immune system's destroying the ingredients, then you can't make as much. And then also there's cellular destruction. So the Hashimoto's destroys the cells of the thyroid, which ultimately lowers your capacity to make the hormone long term, and puts you at risk for a lot of other problems. But it's that's a really important overview here. I wanted to give you guys some insight into the most common factors, I would say, that inhibit the proper production of your thyroid hormone and can cause you to have low thyroid hormone output. Because when you look at it, if you're like, hey, I'm hypothyroid, the doctor checks your TSH and they look at it and you're hypothyroid. Well, why is that? And if you have, and they don't really know, they're just like, you'll hear things like it's age related. I don't agree with that. I mean, we know that TSH, your thyroid stimulating hormone, which is what's usually checked, does tend to go up and increase with age. But it's not age. If it were age related, then everyone that was your age would have the same problem you have. It is not age related. There are other factors at play. So you've got to realize that it's not age related. There are many other factors at play, many of the things we just talked about. And the question is, what is happening to you specifically? If you can identify what's happening, what is driving the process, then you can put together a very specific and unique plan to address your individual problems. That's really the key. I mean, it's so simple yet so difficult to have anyone do, because quite frankly, there are very few people trained in this stuff that we talk about, guys. They really are. I have lived autoimmunity since I was 20, I think 4 or maybe it was 27. I don't remember exactly, but I developed psoriasis. And then, far before that, like when I was probably 12, terrible gut issues, terrible irritable bowel, all kinds of GI tract issues for years and years, constipation for over a week on end, and that was at 12. And then even prior to that, which I often forget, and I guess it's because it was a part of my life I kind of didn't want to remember, so I never. But the more that I've studied, the more I realize, and I've reflected upon my own life, I realized that whenever I was really young, like first grade, diagnosed with ADD and ADHD, or whatever, it's ADHD, that was very likely a factor of inflammation and of gut issues. We know that the gut and the brain are directly connected. We know that when there's gut dysbiosis or gut inflammation, that there's more brain inflammation, and there's more difficulty with clear thought processes, optimal neurological signaling between neurons, that the inflammation disrupts that. And there are all kinds of developmental issues. So, my diet was terrible then. My parents they did the best that they could, but they didn't know any better. So there have been a lot of factors that brought me to this point, but then my study of how to help myself, just not being satisfied with some of the answers that I got with my psoriasis. And I just said, what? Enough. And I started doing my own research, and then I got into really digging into this natural health care, functional medicine, precision medicine, and epigenetics and genomics, and started seeing this much more clearly for myself. So it's been a lifetime, and it is an ongoing process of learning. But I wanted to share this with you guys because I think it's really important. I've got a lot more stuff to talk about I want to share with you, but I wanted to share with you in particular these factors that really decrease the proper production of thyroid hormone, because I think it's critical. I think it's important that you understand this. And guys, listen, if what I would recommend to people that are struggling, there's a few things you can do. You can do some things to try to help yourself if you haven't made changes. But if you really want to try to get the fastest results possible, if you want to try to save time and money, speed the process up, get advanced diagnostic testing to help you pinpoint the problems to the best of your ability, put together a specific and precise plan. If you need assistance with that, reach out to me in my office. You can go to drbradshuk.com. I work with people worldwide, across the U.S. We help them get advanced diagnostic testing. We help them to really put together specific and customized plans for them. And we can do that via Skype, FaceTime, phone calls. We can get testing done near you. We can do it all. So, we're able to help people. If that's not something that is an option for you, then you may want to consider joining our transformation community. My staff and I brainstormed and we said, how can we help the most people and change the world? And what we did was we took everything that we've learned to this point, and we're constantly refining these things, and we put them into dietary and lifestyle programs that we made as simple as we possibly could. We said that was our mission. Let's make these as simple as possible so that people can implement this. Let's spoon feed them. Let's give them every resource possible. Let's give them the dietary approach. Let's give them the lifestyle things they need to do. Let's make it simple. Let's give them the supplementation they need to use. Let's make it ultra simple. Let's actually give them access to the supplements that we recommend at our cost. Let's make it as inexpensive as possible. Let's do all these things. Let's give them a support group where other people that are going through this, they can relate to them. They can ask them questions. Let's do that. And that's what we did. We created something called the Transformation Community. And if you go to hashimotosdoctor.com/TCS, you can learn about it. You can learn about the things that are involved in it, and you can join if you want to. But those are all great resources and things that you can utilize, guys. But if you have questions, please do reach out to me. I appreciate you spending your time with me. I hope you have a wonderful, wonderful day. And if there's anything that we can do for you, we are here. And we would love to try to help you so that you can live the best life possible. So I appreciate you. Hope you have a wonderful, wonderful day, and I'll talk to you again soon. Thanks. Thanks so much for listening. We hope you enjoyed hanging out behind the scenes with Dr. Shook. You can also talk with and learn from Dr. Shook through Facebook Live on our Facebook page at the Office of Dr. Brad Shook. Don't forget, you can also get access to our videos, guidebooks, and thyroid programs at www.drbradshook.com. Oh yeah, and don't forget one more thing. We can change the world one person, one family, and one community at a time. Until next time, remember, today is your day, and no one will tell you who you are and what you can be.